Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, listeners. It's Lindsay Smith Rogers, and today, a change to COVID vaccine recommendations. I speak with Sarah Despres, an expert in immunization policy, about Secretary Robert F. Kennedy Jr.'s announcement that the COVID vaccine will no longer be recommended for healthy children or pregnant women. Let's listen. Sarah Despres, thank you so much for joining us on Public Health on Call. So, a quick question to start you out with. How long have you worked on vaccine policy?
Yeah, so I've been in the space for over 25 years, which scares me, dates me. But yeah, I first got engaged on the vaccine policy side in 1998 when I joined the House Oversight and Government Reform Committee, which working for Congressman Henry Waxman, who was the ranking minority member at the time. And the committee was launching an investigation into the relationship between vaccines and autism. What's old is new again. So I started learning about vaccine policy then and spent about 13 years on Capitol Hill during the ACA working on vaccine policy issues. And then I left the Hill and worked in public health advocacy for about 10 years. During that time, I served on the HHS National Vaccine Advisory Committee and also chaired the board of a nonprofit called Vaccinate Your Family, which is, as the title suggests, heavily engaged in vaccine advocacy and education. And then I spent 4 years working as a counselor to HHS Secretary Becerra, left HHS in 2021, and now I'm doing some consulting for some vaccine-related nonprofits.
And you've also served on the board of the National Vaccine Advisory Committee. Is that correct?
That is correct. That's an advisory committee out of the Assistant Secretary for Health that brings together all the various vaccine stakeholders within the U.S. government to work on vaccine policy issues, and also external stakeholders and experts as well.
So it is safe to say that you have a long history of working on vaccine policy.
It is safe to say that, yes.
And we're talking today because Health Secretary Robert F. Kennedy Jr. posted a video on X stating that the COVID vaccine will no longer be recommended for healthy children or healthy pregnant women. And in this video, he was speaking on behalf of the CDC and saying that vaccines would be removed from the recommended immunization schedule. Now, given your long history of working on vaccine policy, what was your reaction to this news?
So my first reaction was that what he had done potentially threatens access to vaccines for a swath of the population. And I also was noted and was sort of taken aback by the fact that there's internal inconsistency between what the secretary said yesterday when he made that video and what FDA had said the previous week when they identified pregnancy as a high risk for COVID. So my immediate reactions were concern about the substance of the decision making and what effect it would have in practical terms for people who need and want the vaccine.
So, and let's talk a little bit about the process. How was this done differently from what you've seen in the past?
Yeah, so I know there's been a lot of focus on process, and I just want to say at the outset that the process here is really important because the process that we have using the Advisory Committee on Immunization Practices, which is run out of the Centers for Disease Control and Prevention, provides transparency, public input, and expertise. Not just scientific expertise, but also clinical expertise. What do the recommendations of ACIP mean in the real world? That said, I think we always have to be open to reevaluating the process. So I think that it's important to understand that what happened here was unprecedented, but it was unprecedented in a way that undermined the credibility of the decision itself and portends for future decisions. So, it's not that the process wasn't followed and we need to always follow the process. It's that the process here ensures a level of transparency and credibility for the decisions that are made. and takes into account the practical considerations to make sure that people who need access have access. So usually what happens is, and what had been happening, is the Advisory Committee on Immunization Practices has work groups that evaluate recommendations. And recommendations such as the COVID recommendations have been under constant reevaluation since before the vaccine even came out. The same is true for flu. You know, the flu recommendations and the evidence around flu vaccines are constantly being reevaluated by the work group. The Advisory Committee on Immunization Practices met in April, and it was clear from that meeting that a lot of the members of the committee were interested in reevaluating the recommendation, particularly as it related to healthy children, for boosters. And the advisory committee was scheduled to meet, I think they're still scheduled to meet in June, to actually consider whether or not the recommendations should be updated, given the science and the changing circumstances. And so had the committee met, they would have voted out a new recommendation, or they would have kept the same recommendation. But it looked like they were going toward a recommendation where healthy children were probably not going to be routinely recommended for the booster dose. Though I do want to caveat that by saying, because the advisory committee recommendations, if adopted by CDC, actually determine whether or not insurers and public players are required to cover these vaccines, ACIP could have made a recommendation for boosters that would have allowed for families that wanted to get their healthy child a vaccine. They could have written the recommendation in such a way that that vaccine would still be required to be covered by insurance using a mechanism called shared clinical decision making, which basically says consult your provider. And so they could have done a recommendation that wouldn't have taken away or risked coverage for healthy kids. That is not what happened. What happened when the secretary made his announcement, I think, though we don't have a lot of clarity, is it was a blanket, healthy children are no longer recommended to get this vaccine. There was no evidence that I'm aware of that the Advisory Committee on Immunization Practices was going to rethink the recommendation with regards to pregnant women, because we know that pregnant women are, as FDA said last week, at high risk for COVID, and that the children, babies, who are hospitalized with COVID before they're 6 months old are more likely to have been born to a mom who hadn't been vaccinated. So the vaccine is important both for the mom, but also for her baby once the baby is born. So what we saw with the secretary's announcement was a blunt instrument to what should have been, from a public health standpoint and from the standpoint of families seeking to make the decisions about how best to protect their families, should have been a carefully considered process for, and recommendation.
There's a lot to unpack here, but let me start with just a couple of basic questions. The first one is, does this also include primary vaccination for children who are like 6 months old who've never, because you mentioned boosters, what do we know about primary vaccines?
Yeah, so there's so many questions that came out of both FDA's framework that was announced last week, as well as the approval of the Novavax vaccine, which also happened the same week of the framework, and what the secretary said in his tweet, in his video, whatever we call them these days. And so there are a lot of things that we just don't know. And I think one of the important things we don't know is the recommendation and the framework that FDA articulated last week. Is it specific to boosters, or does it also include the primary series? I'm inclined to think that it includes the primary series, which means that children who have never been vaccinated for COVID, they won't have the benefit, healthy children won't have the benefit of getting the primary series of vaccines to protect them against that first COVID infection. And we also know that the youngest children are at higher risk for COVID infections, but we don't have clarity. And so it's really hard to know. But I do think it's a really important question, because again, where ACIP seemed to be going was changing the recommendations for COVID boosters, but not for the primary series. And it looks like the secretary may have essentially taken away the opportunity for the youngest children to get that first primary series of COVID vaccines. I do also want to say that the secretary in his announcement yesterday provided no data or evidence. And so when CDC issues a recommendation, they have, it's written in the Morbidity and Mortality Weekly Report, which is a CDC publication that clearly articulates the rationale for the recommendation. The only rationale we got from the secretary in his announcement was that this was common sense, which is not the scientific standard, I think, that we're used to for this kind of decision making that really needs to be based in facts in order to have the credibility and in order for providers to really understand what it means for them and their patients.
And there is a lot of evidence showing that vaccines for, certainly primary vaccines for infants and vaccines for pregnant women are helpful, correct? Like the risk benefit there is clear.
That's right. And in the Academy of Pediatrics and the College of Obstetrics and Gynecologists put out very strong statements the day the secretary made his announcement, articulating that from their standpoint as the providers to these patient populations, the evidence was clear. I think the other thing that's important to understand is that there just isn't evidence of harm. We do know that for college-age men that there is an increased risk of myocarditis from the vaccine. We also know that COVID infections can cause myocarditis. And so I think that we need to be clear-eyed that there are some risks associated with this vaccine, as there are with all medical interventions. But they're certainly much lower than the risk of actually getting the infection. And so I think both for FDA and CDC, traditionally, when they make their calculations and their recommendations or their approvals, it's based on ensuring that the evidence of benefit outweighs the evidence of harm. And again, we have not seen a clearly articulated rationale that goes through what the evidence for both is coming out of the secretary, which is concerning, particularly on the heels of his own statement last week under oath that people should not be taking medical advice from him. And so it's not clear to me how this decision was made and what the science, what the facts were in underpinning it. And again, the process is not important as a process, but the process is important to get us to a place where people who need access to this vaccine have access, and that people who are following the recommendations, which should be providers and the public, have confidence that the recommendations are actually based in fact.
So it sounds like Secretary Kennedy made a unilateral decision. There are big concerns about both the substance of that decision and the process of how it was made. What are some key questions that you have about what happens next?
Yeah, I mean, to me, there are two biggies. The first is, what does this actually mean for access? We know that any time additional hurdles are put up for immunization, that we reduce the rates of immunization. And so here, what we don't know is how payers are going to react, private payers and also public payers. Think the Vaccines for Children program, Medicaid, Medicare, all of those payers are part of HHS. So I don't know what actually will happen with regards to insurance coverage for these vaccines, but it looks like the insurance coverage will no longer be required. So that for those populations, I think that's one concern. Another concern that I have is how you demonstrate to the pharmacy, for example, that you are in a high-risk category. If you are, let's say, you're 17 and you suffer from some kind of mental health condition, which puts you at increased risk for COVID, as per the FDA. You go to the pharmacy because, a lot of 17-year-olds aren't going to their pediatrician. And you go to the pharmacy. What are you supposed to say to the pharmacist? How is this pharmacist supposed to know that you suffer from this? I think for pregnant women, I mean, again, it's so curious because pregnant women by FDA's own determination should all be covered. Now it's high-risk pregnant women, and we don't know what that means. I am nervous about any additional barriers on access to vaccines for pregnant women. I would hope that if you're pregnant, you're under the care of a physician. But again, the same problem. What are these high-risk conditions, and what do you have to do if you're going to the pharmacy, if that's where you're getting your care? What do you do to demonstrate to the pharmacist that you've got some condition? So I think those are a lot the questions I have around access and what it really will mean in the real world. Then there's the other question of what does this mean for future vaccine policymaking? Because we know that the secretary has raised a lot of concerns about a lot of vaccines. We also do not have a CDC director. And so traditionally, the role of adopting recommendations from ACIP has been delegated from the secretary to the CDC director. Well, now there is no CDC director, and it's unclear if there's even a legitimate acting CDC director. And so that activity is now in the hands of the secretary, and the secretary has raised concerns about a lot of different vaccines. And so I guess the question I have is, what does this mean for vaccine policy making in the future? And is this COVID specific, or are we going to see changes from the secretary to other vaccine recommendations, which again could have an effect on confidence in the recommendation and, depending on what a recommendation looks like, actual access to the vaccines?
So it sounds like there's a lot of confusion and maybe some alarm in this moment.
There is a lot of confusion, and yes, there is certainly alarm. And I think that part of the alarm is because of the confusion. It may be that if we had clarity, we would continue to be alarmed. But what has been so difficult is the way that they are rolling out these decisions beg more questions than answers. And I think that it's important that, again, we constantly reevaluate the process we're using for vaccine policymaking, all policymaking. And also, we need to constantly be reevaluating how public health is communicating guidance and decisions. But one thing we know is you need to be very clear with the public about what it is you are doing and why. How you communicate is, a different issue, but the substance of the communication has got to be clear and understandable for the intended audience. And that's not what's happening here, which is, again, causing a lot of confusion and is leading people like me to come up with worst case scenarios, which may come to pass or not. But without the clarity, it's really, really hard for anyone to make plans and decisions about how this is actually all going to play out.
Well, Sarah Despres, thank you so much for bringing your expertise and your years of experience to this conversation, helping us unpack the news here.
Thank you for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, Stephanie Desmond, and Grace Fernandez-Cesiri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Cesiri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.